Homelessness in the US continues to rise in 2025, reflecting deeper economic, social, and policy failures. This overview explores what's driving the crisis, who is most affected, and possible solutions. Section 1. The scale of the crisis. As of January 2024, HUD reported 771,480 individuals experiencing homelessness, a record high and an 18% rise from 2023. 36% were unsheltered, living in encampments, vehicles, or public spaces. Family homelessness surged nearly 40%, while veteran homelessness dropped 8% due to effective programs. Section 2. Root causes. Homelessness stems from systemic, not personnel failures. Affordable housing shortage. A lack of low-cost rentals forces millions to spend over 50% of their income on housing. Rent inflation remained around 4.8% in late 2024, and vacancy rates stayed low. Wages lag behind costs. Nearly 20% of households have under $100 in savings. 1/3 couldn't afford rent for more than a month without income. Stagnant wages and weak public benefits worsen housing insecurity. Unemployment. 20% cite job loss as the primary cause more than addiction or mental illness. Economic slowdowns and local job markets deepen the crisis. Mental health, substance use, and domestic abuse. These are significant contributors. Domestic violence accounts for 15% of homelessness, with women more likely to report at 19.5% versus 10.4%. Evictions and past trauma, high rent burdens, and weak tenant protections drive evictions. Adverse childhood experiences like foster care are strong predictors of future homelessness. Systemic inequality. Black, Indigenous, and Hispanic populations are overrepresented. For instance, Black Americans are 12% of the population, but 32% of the homeless. Causes include racism, disinvestment, and exclusion from housing markets. Section 3. Who is affected? Groups include individuals, families, veterans, unaccompanied youth, the chronically homeless, and older adults. Nearly 150,000 children were homeless in January 2024, a 33% year-over-year rise. Veteran homelessness declined 8% due to Housing First and tailored programs. Section 4. Impacts on communities. Homelessness burdens health systems, emergency services, and local budgets. Residents report decreased property values 42%, increased safety concerns 38%, and reduced business revenue 37%. Section 5. Policy responses and solutions. Housing First, proven to reduce chronic homelessness when scaled. Affordable housing and tenant protections. Building units and preventing unjust evictions are key. Income supports, living wages, and better benefits help households stay stable. Health services improve access to addiction, mental health, and trauma care, especially for youth and abuse survivors. Targeted support. Programs must focus on disproportionately affected groups like BIPOC and unaccompanied youth with culturally competent care. Section 6. Recent policy debate. In July 2025, President Trump issued an executive order requiring cities to clear encampments and institutionalize people with mental illness or substance issues. Advocates argue this enforcement-first model ignores root causes and violates rights, risking further harm. Conclusion. Homelessness is growing not due to individual failings, but systemic issues: housing shortages, wage stagnation, and inequality. Real solutions must prioritize housing as a human right through coordinated investments in housing, income, and care.